Koncept Hospital has a very novel way of diagnosis also. Apart from the conventional blood diagnostic procedures, we do what is called as live blood analysis and dry blood analysis. Live blood analysis is nothing but just taking your blood by a prick and mounting into the microscope and seeing them live, where in normal conventional methods we put the dye into the tissues or in the blood and kill the cells and only see the dead cells. In the live blood analysis, the live blood, where you can see the movements of the white blood cells, you can see the movements of the red blood cells and the platelets in its original form. Now, what is the need for this? To look at the live blood analysis. Because live blood analysis gives us lots of information about the internal system. It gives information about your body terrain, basically the pH of the body. When you look at the blood cells, the RBCs have to be separated and isolated, which is considered to be the normal healthy blood. If you see that there is a clumping, it says that there is too much viscosity in the plasma, which is nothing but a reflection of what is called as increased acidity in the blood. And you can also see a lot of organisms which are present in the blood. You can see a lot of toxic load, undigested food particles, and many more into the live blood analysis, where you can see with your own eyes and understand what it is. Now, what is the need for this again? Because this gives us a lot of information about the terrain inside the body. Many of the diseases what we get in our life is because of the disturbance in the pH of the body. When the terrain is corrected, the pathogens like the bacteria, virus, fungus and all these things cannot live in it. So instead of using an antibiotic, you can just change the body pH and drive away all these bugs or the pathogens in the body. So live blood analysis gives us an idea about what is the type of terrain you have, what is the type of cells you have, how much oxygenation is there in your blood, right? What is the pH and what is the toxic load and what is the nature of the cell wall, which also reflects as the nutritional capacity of the patient, and how much toxins are there, that is the leak from the intestine. What we have, what is called as a leaky gut syndrome, because leaky gut syndrome is one of the most important cause for many of the chronic diseases. So we can identify whether there is any leak in the gut also using this live blood analysis. What is the possible outcome? That is, we can define to the people that what type of approach they have to do, whether they need to have any lifestyle changes, whether they need to have any dietary changes, whether they need to have any other addition or nutrition support or something like that. Or sometimes if there is too much of leak from the intestine, we also suggest them to go for what is called as colon hydrotherapy. Cleaning the colon or inside of the body leads on to cleanliness of the entire body, including the blood. So live blood analysis gives us a very clear indication about the terrain inside. And we also do what is called as dry blood analysis, where a drop of blood is taken into the slide, which is just left it for a few minutes and you get the blood dried. This dried picture of the blood drop gives us a lot of information about the oxidative stress. The rotten part of the body, or the what we call as the damaged part of the body, can be also understood, identified, and the corrective measures can be initiated just by looking at the dry blood analysis. So live blood and dry blood analysis are one of the novel methods of diagnosing disease without any major intervention being done. So it is safe and gives a lot of information. Give a try.